Our next speaker is Dr. Edmarie Guzmán-Vélez, and I'm going to go ahead and introduce her. Edmarie, if you'd like to get your slides up on the screen while I introduce you, we can make sure we can quickly transition to your presentation. So Dr. Guzmán-Vélez has a degree in psychology from the University of Puerto Rico, Rio Piedras, and a doctorate in clinical psychology with a specialization in neuropsych from the University of Iowa. She's worked as a postdoc in the Multicultural Alzheimer Prevention Program, directed by Dr. Yakil Quiros here at Mass General. And as a postdoc, she identified tests that are sensitive to early pathological changes in familial AD, and that can reliably differentiate individuals in the preclinical stage of AD from adults with no genetic predisposition. She's also worked as a clinical fellow at the Mass General Multicultural Neuropsych Program, MUNDOS, conducting neuropsych assessments to mostly underrepresented minorities. And as an instructor at Mass General and HMS, she has extended her research to investigate interventions to protect against the onset of cognitive decline associated with several neurodegenerative disorders with a focus on AD. And most recently, and in collaboration with the McCance Center, she's the PI on a clinical trial for long COVID, assessing the efficacy of a dietary supplement in alleviating some of the neuropsych symptoms associated with COVID in these patients. So with that, I'm going to hand it over to Edmarie. Welcome, and thank you for taking the time.
Thank you very much for invitation. Can you see my presenter's view or the slides?
We can see just the slides.
Wonderful. All right. Well, thank you again for the invitation. Today, I'll be presenting some of the preliminary data from our baseline data from a trial that we started last year in collaboration with the McCance Center, ACTRU, and with the support of ChromeDX as well. All right. So as you all know, there have been more than 500 million cases of COVID infection worldwide and over 6 million deaths. And it's hypothesized that COVID-19, it uses angiotensin-converting enzyme as the main docking receptor, and infection of host cells via ACE2 receptors. It triggers an immune response, including the excessive expression of cytokines and chemokines, excessive recruitment of inflammatory cells, insufficient interferon response, and others that eventually lead to tissue damage, cell death, and organ failure. And so while most people, over 90% of, well, I guess we still don't know exactly the number, but the vast majority of individuals do recover within a month or two. We are now learning more and more that there's a significant percentage of individuals who were infected with COVID that actually never fully recovered and continue to experience symptoms. And some people have, it's known as long COVID, long haulers, PASC. So I'll use the name long COVID today to refer to those individuals who had COVID, were infected with COVID, but never fully recovered. And so these individuals report that a lot of their symptoms never went back to baseline or they never just fully recovered, but that also some symptoms started a few months or weeks after infection. And these are the most common symptoms that people report with long COVID, with the most common being fatigue, headache. So the more red the color is, the more common that symptom is. And you can also see that a lot of people also complain of attention difficulties, memory loss with the so-called brain fog. Individuals also report a lot of sleep issues, particularly insomnia, anxiety, symptoms of depression. So really, it's a multi-system disorder that causes all sorts of symptoms, and definitely neurological symptoms are very prevalent and also some of the most debilitating in these individuals. Now, it's unclear how many individuals specifically have long COVID. Some people say about 30% of individuals who were infected, others much less. It's very unclear, in part because people define long COVID differently. But I think we can all agree that it's a huge problem. It's millions of individuals who are experiencing long COVID. And it's likely to be impacting some groups disproportionately, just since we know that COVID-19, for example, disproportionately affected some ethnic and racial minorities. It's also impacting quality of life and daily functioning. It's estimated that about 1.5 million individuals either stopped working or went part-time and worked due to long COVID symptoms. And we've definitely seen that in our participants. A lot of them have stopped working or are only working part-time or completely switched jobs. And this is likely to become worse due to the recent COVID wave. Because even though it's specifically Omicron didn't cause a lot of severe symptoms, we know that a lot of individuals with long COVID never ended up in the hospital. And even a lot of them even had mild symptoms, were relatively young and healthy. So it's very likely that the number of individuals with long COVID will continue to increase. And unfortunately, we don't have any treatment for it, although in part it's because we're still trying to figure out what long COVID is. Now, something that we know is that SARS or coronavirus in general disrupt the NAD plus metabolome, and COVID-19 may also disrupt the NAD metabolome. And NAD plus is a cofactor found in every cell of the body, and it's involved in multiple metabolic pathways. We know that decreased NAD impairs the Krebs cycle, and that there is an overall reduction of ATP production and brain metabolism. We also know that NAD decreases with age, and particularly in neurodegenerative disorders. Nicotinamide Riboside is a form of vitamin 3 that is a precursor to NAD+, and therefore by NAD can be replenished via supplementation of nicotinamide riboside. And some research, mostly based on animal models, have shown that increasing NAD plus improves in mitochondrial activity. It prevents axonal degeneration, decreases inflammation. It's been shown to help with some of pathological abnormalities seen in Alzheimer's disease. And what's also very important is that nicotinamide riboside is safe, it's well tolerated, and as such, it's a promising treatment or supplement to help reduce some of the symptoms that individuals with long COVID are experiencing. And so the goal of this clinical trial, which is in collaboration with Dr. Stephen Arnold of ACTRU and his team, together, like I said, with the McCance Center and Chromadex, is to test whether nicotinamide riboside can increase NAD plus levels in individuals with long COVID and help improve some of the symptoms that they are experiencing over a 6-month period. Specifically, we are measuring whether nicotinamide riboside, in addition to increasing NAD levels, if it can help improve cognitive functioning and in these individuals, both objectively and subjectively, whether it can help reduce some of the neuropsychiatric symptoms that individuals experience, as well as improve physical functioning. We aim to recruit 100 individuals. It's a randomized placebo-controlled clinical trial, and we're recruiting individuals between the ages of 18 and 65. 60% will be assigned to the treatment group, and I will show you the design of the study in a little bit. And we're recruiting from the McCance Center, Mass General, Raleigh. A lot of physicians have been referring their patients to us, and from the community. In order to measure cognitive functioning, we'll be using a battery of neuropsychological tests that have been validated in both English and Spanish. So far, we've only tested individuals in English, but we do have a whole team that's bilingual, Spanish, English, and bicultural, so that we can also recruit individuals who speak Spanish. The battery has tests of naming, so language, executive functioning, attention, processing speed, memory. We're tapping a little bit into different cognitive functions. And we're also measuring subjective cognitive concerns using the ACOG. In addition to that, we are measuring neuropsychiatric functioning with the Beck Anxiety Scale and Depression Scale. Some symptoms associated with trauma with COVID is measured by the PCLC. And also we're looking into sleep using the Pittsburgh Sleep Quality Index scale. We're also measuring some physical functions like lung function using expiratory volume, also strength using a dynamometer, walk, turn, tense, and we're also doing a medical neurological evaluation. In addition, we have a scale of only fatigue since it's the most prevalent symptom. And in addition to that, we created what I call the COVID-19 symptom questionnaire. It's a list of the most common symptoms associated with COVID-19, and we ask, have you experienced these symptoms in the past 2 weeks? If yes, have they been mild, moderate, severe, very severe? And if they are experiencing that symptom, how is that interfering with their quality of life? Is it interfering, or if it is interfering, is it sometimes, often, or very often? And I'll show you some of those data today. And in addition to that, I'm not going to show these data today, but we are collecting data on physical activity, both with self-report questionnaire, the IPAC, but also using a Fitbit, because one of the things that I'm particularly interested in, and we are as a group, is seeing if by also taking Niagen or nicotinamide riboside, individuals are able to be more active and engage more in physical activity, and whether engaging more in physical activity is associated with a better recovery of symptoms over time. Our participants, they all must have had concerns of cognitive difficulties. So they all experienced brain fog, and also they must continue to experience at least 2 symptoms in addition to brain fog associated with COVID-19 infection. They must have been infected at least 2 months prior to study entry. But as you will see, most of our participants were infected way before just 2 months. They must test negative at study entry for COVID-19, not have any specific CNS or central nervous system history or major active or chronic unstable psychiatric illness, a minimum score of 80 on the MMSE, and no prior history of dementia or mild cognitive impairment prior to COVID-19 infection. And most importantly, these are individuals who were not in the ICU or did not have severe symptoms. The vast majority of our participants, I think for the exception of one person, were never hospitalized, and it had mostly mild to moderate symptoms. So this is the design of our study. They come in for a screening visit, then they return, and they all start in placebo. They return after 2 weeks, and then at this time, 60 individuals start taking Niagen throughout the study trial, and the other 40 continue in placebo and then switch to Niagen for the last half of the clinical trial, and then we do a follow-up at the end. They come, like I mentioned, they come for screening, return 2 weeks after, and then every 5 weeks for testing. These are the individuals that we've recruited so far. So 22 individuals have completed screening, 17 baseline, and 7 individuals have finished the clinical trial, which is really exciting. And we have a lot of individuals scheduled to come the next few weeks. And so today I will show you the data of the 17 individuals who've already completed baseline. All right, so let's get into our preliminary findings. So consistent with the literature, the average age of our participant, it's 48 years. It's pretty common. It seems like a lot of studies are reporting that a lot of individuals complaining of long COVID are in their 50s. We have individuals as young as 29 up to 65. Most of them are highly educated, which is not surprising. They've completed university or more, but all have at least some college experience. Most of the participants are female, but we almost have a half-half split in terms of sex. Most of them are white. We have one person identifying as Black or African American and one identifying as Hispanic or Latino. And this is something that we're hoping to change. We're really striving to have a more ethnically and racial diverse sample. In terms of BMI, the average was 29. And surprisingly, most of them were pretty healthy prior to being infected with COVID. We had 5 individuals out of 17 who did have hypertension, 3 diabetes, 2 high cholesterol. All of the others were just pretty healthy, just individuals, really no big issues before being infected with COVID-19. And so with the COVID symptom questionnaire that I mentioned earlier, we were able to track how many symptoms people are experiencing, and the average number of symptoms is 11. And it ranges from 5 to 20. So some people are complaining of 5 symptoms, some people are complaining of even 20 symptoms. So there's quite a bit of variability. And the average time since infection, from infection to study entry, is 68 weeks. And as a reminder, a year has 52 weeks. So most of our participants were infected with COVID more than a year ago, and they continue to experience symptoms. This is the distribution of the symptoms that people are complaining. This is the percent of individuals out of those 17 that are complaining of each of these symptoms. And those in blue are the most common ones. So those in blue are the ones that more than half of the 17 individuals have reported that they are experiencing. And these are fatigue, muscle aches, altered smell, taste, headaches, dizziness, loss of appetite, constipation, brain fog, and insomnia, which is also pretty consistent with the literature. And of those who are complaining of fatigue, vast majority complain of severe fatigue based on the fatigue scale that they completed. And so then what I did was I took these symptoms that are the ones that most people are experiencing and looked at how they are interfering with their daily activities. So literally what we ask is this interfering with their daily activities? And if so, does it interfere sometimes, often, or very often? And these are the different symptoms that I just showed you. And as you can see, brain fog is one of the symptoms that most interferes with their daily activities, but also the fatigue, the muscle aches, the altered smell to some extent, but not so much. So altered smell is one that a lot of people are experiencing, but it doesn't interfere as much with their daily activities, whereas things like brain fog and fatigue do. Then we ask them to complete the Beck depression and anxiety inventories. These are the means and standard deviations, but to put it into context, we divided them in severity. So based on the score, you can divide individuals into severe symptoms of depression, moderate, mild, or minimal. If you look at anxiety, most of individuals are complaining of moderate to severe symptoms of anxiety, and a lot of individuals are also complaining of moderate to severe symptoms of depression. And I actually don't have the exact number, but some of them did have a history of depression and anxiety, but most of them did not. Then we looked at symptoms of trauma associated with COVID. The question is specifically associated with COVID. And we do see that a lot of individuals are endorsing high levels of anxiety. Now, when you look at the different items, you know, with these PTSD scales, the questions are very different. Some questions have to do with nightmares associated with the event, but others are more somatic. And so a lot of the items that people are endorsing have to do with the poor sleep and a lot of the symptoms that overlap with the Beck anxiety inventory. So just these individuals are just experiencing a lot of anxiety associated with COVID and the current symptoms. We asked in the past month, how would you rate your sleep quality? And most people are not sleeping well. This is something that everyone is complaining about, some more than others, but definitely sleep difficulties are very prevalent in this population. These are the results for subjective cognitive concerns, and this is the total of the scale, but you can divide it into different cognitive domains with memory, language, planning, organization, attention, visual, spatial. And as you can see, most people are complaining of difficulties with memory and language. With language, it's specifically word finding difficulties. And what I've noticed myself when I talk to them, even during conversation, I can see some of those word finding difficulties. And so for objective cognitive tests, these are the tests from the R bands. They're converted to Z scores. And so all of these scores have been converted to Z scores based on age norm. So compared to individuals of their same age, how are they doing? And as you can see, I was actually very surprised with these findings because there's a significant number of individuals in this sample that are doing 1 to 1.5 standard deviations below the mean for their age. And it seems like most individuals are having difficulties with memory. So all of these tests are related to learning and memory. This is a visual spatial test. Naming, as you can see, they're doing poorly. And given this is actually a very easy naming test, only 10 items. This has to do with language, semantic fluency, measure of basic attention and processing speed. And also a lot of them are doing below the average. When you look at other measures of executive functioning and processing speed, you also see that, please note that the scale is different compared to this one. A lot of individuals are also performing 1.5, 2 standard deviations below the mean. And so what this is telling us is that people are not only feeling like they're having cognitive difficulties, but even these tests are being sensitive enough to capture some of those objective difficulties. And so in summary, I think so far what we've learned from this sample is that most of our participants were infected more than a year ago, and they continue to struggle with a lot of symptoms associated with infection, most of them complaining of at least 5 symptoms. Fatigue, muscle aches, altered smell, headaches, dizziness are the most common ones. And these are also interfering with their daily activities. Memory and language difficulties were the most salient cognitive concerns. And we also saw this in objective cognitive tests, where there were difficulties with memory tests, processing speed, and also some tests of executive functioning. We still have to analyze data from the CPT, which is the test of sustained attention. And my hypothesis is that that's where we're going to see most of the effects, given that it is a more challenging test and a way better measure of sustained attention than the ones that we have that I just showed you. And most of our participants are experiencing anxiety and depression. So we continue to recruit. We're hoping to really diversify the distribution of race and ethnicity in our sample. We collect blood at every visit to measure NAD+, but also we're hoping to look at markers of neuroinflammation and neural injury. I just submitted a grant. Hopefully we'll get funded to increase our sample of individuals who get MRIs, so that we can also look at not only structural differences in the brain, but also changes in how the brain's functionally connected, particularly in networks that we know are very sensitive to early changes in neurodegenerative disorders like Alzheimer's disease. So for example, looking at the default network or the ventral attention network, which is very important for executive functioning. So I want to I think I'm finishing just in time. I want to thank everyone in ACTRU. It's an amazing team, everyone at the McCance Center and ChromeDX for their support, our wonderful clinical research coordinators, all of our referring physicians. Thank you so much to all the physicians that's been referring their patients to us, and of course to all of our participants for donating their time. This is my contact information, and this is our email. So if you have any patients or know anyone who may be interested in the study, please email us. And we'll be happy to contact them. And I'm happy to take any questions.
Thank you so much, Edmarie. It's really remarkable to see how these symptoms are persisting well beyond a year in these patients. So this is really important work. And good luck with your continued recruitment, and it'll be interesting to see how, as you diversify your data, how healthcare disparities and socioeconomic factors kind of contribute to this. We'll have time for one question, and there's a question here from Dr. Ran, so I'm going to read that out. There's been a recent study, perhaps in Cell, that identified risk factors for developing long COVID. Did these factors match your observation?
Some of them. So actually, this is something that we need to look at more carefully. And it's something that I do have in mind to do soon, to take a closer look at the history, family history, also just their medical history in general. So far, it seems like it is a match. Like I said, if I'm not mistaken, in this article, cardiovascular risk factors were pretty relevant in this population. We're not seeing that as much in our sample, but again, we only have 17 people so far. So it may be that as we increase our sample, we will see individuals who had hypertension or hyperlipidemia or diabetes prior to infection. I think in that case, it's something we haven't seen yet. For the rest, it seems to be pretty consistent with what that article reported.
And then there's one more note from Zaina here, where she says, you're validating what we see in the clinic, what Zaina and other clinicians are saying here too. And it remains problematic that the cohort is mostly white as illness behavior is different.
Yes.
So, yeah.
Yes, and so far it's been incredible. Thankfully, we've had the issue of not being able to keep up with a very long wait list. There's so many people that have been contacting us, and all of these are coming from Raleigh. And the type of demographics that we're seeing that contact us through Raleigh is mainly
Edmarie, we can barely hear you. Your connection is not good, so we did not hear anything you said.
Ethnically and racially diverse.
Edmarie, sorry, we seem to have lost you there. The connection seems to have skipped a little bit, but we really do look forward to hearing more as you continue your recruitment. And thank you very much for presenting your preliminary findings here today. And thank you again to Dr. Gale. And we will see everybody again in 2 weeks. Have a lovely week. Enjoy the beautiful weather. Edmarie, sorry to have cut you short. We seem to have had some internet issues there.